imbalance of I think this I'd like to see you speak in English. Okay. So let me introduce myself. My hometown, Hirosaki, is located at the northern tip of main island of Japan. It is 750 kilometers from Tokyo, and it's famous for cherry blossoms and its summer Deluca festival. I am a second-generation dentist and working with my father in my office. If you have a chance to come, please visit us. The title of my presentation is Digital Solution with Functional Analysis to Optimize Implant Restoration. Today, I will discuss ideal prosthetic treatment utilizing functional analysis. I have chosen two keywords. One is functional analysis. I will explain why functional analysis is necessary. The second is recording. I think that this is the most important point for the next generation of those who will be doing implants. Let me talk about the value of experience. Yuichiro Miura, an 80-year-old Japanese man who happens to be a very close friend of my father, recently challenged and succeeded in his third climb of Mount Everest. I think that he succeeded because he had the experience value of having achieved his feat two previous times. However, even though nobody knows the sensitivity and the technique of such an expert, his example serves as a challenge and a standard for those who will follow his footsteps. It is the same in dentistry. This is one of my past treatments showing the before and after. The purpose of a functional analysis is to achieve a similar outcome as that of an expert who has greater experience. To that end, digitization is necessary. This is the border moving of mind, and also the last patient is coming. It is individual, and their movement is blind. But digitization enables us to visualize. We can see all movement through the computer and find out their movement going well or not. Therefore, digitization makes it possible for follow the same procedure. For example, KaVo system is available to do the same thing. We can evade the technical error from direct procedure. And also, hardness and bending strength of implant prosthetic materials has been stronger than natural teeth. So, to make the less interference in the structure, I recommend to analyze the individual mandibular movement each patient. If your case is small, I should do that. My digital solution started since 1997. I have used the Shirona's graph analyzer system to record the patient. This slide shows the ideal chewing cycle when Professor Mariana first introduced in 1988. It produced good function for the key point of form and speed of the album, and intercastal position coincides with the end point of the mastication. I evaluated preoperative mandibular movement at the provisional restoration and after setting the suture structure. 14 years have already passed, and we haven't seen any significant change based on the digital record. So, I do believe that we provided reasonable occlusion at the time of the treatment. The good point here is we can check the function in the digital device and leaves us with the subjective record. As a result, it improves the patient's quality of life. Progress. My current treatment approach is always progressive. Using the KaVo ARCUSdigma tool, the mandibular movement is reflected by an actuator. Transfer. It is now easy to transfer a provisional restoration to a final restoration using ARCUSdigma tool and the proper Excel. The software is also progressive. For example, we can perform a dual scan and stone matching with a conveyor CT by Implant. We can also make a search guide from this data. Using in vivo file by Anatomage population. Photo matching and the anatomy model of the teeth is now also possible. Furthermore, these simulate implant position and enable also noted analysis by additional software swing analysis. This patient is 55 years old man. His chief complaint was that he wanted to make a comeback as a semi-professional dentist. To do so, he said he needs a strong line in his posterior teeth. Looking at the X-rays, it was clear that the right lower first molar tooth had root fracture. It was already established. The lower left posterior teeth were already lost. So before beginning the treatment, using a KaVo ARCUSdigma tool, I recorded his original mandibular movement. Then I projected his recorded data to an actuator and mounted a skull model. Using an in vivo file by Anatomage population, I examined his occlusal plane through orthodontic analysis. It seemed that the naturally molar part was in extrusion. This is different from an ideal occlusal plane. An ideal occlusal plane is necessary to attain good function. Therefore, we modified the occlusal plane in his original mandibular movement and made a wax setup. Then I scanned a wax setup model and matched it with a Implant. I also simulated an ideal implant position based on the imaginary final suture structure. I also made a search guide. Next, I performed the implant surgery using a inserted the Swedish and Martina implants. This photo was taken after the setting of the final superstructure. Because the transfer was mounted by a Digma tube, the occlusion is stable. This is a final functional analysis of the final superstructure. It is stable, and we can see the alignment of intercostal position and the end point of the mastication. These are images taken before and after the treatment. It seems that the occlusal plane has attained an ideal position. A few months later, he just handed me a letter. It said that as a result of his implant treatment, he had been able to win his fourth regional tennis tournament championship. His dream finally came true, and I was very happy as well. The second keyword is for the next generation. What will happen 10 years or more to the cases I have treated if I offer in practice? Who will look after those patients? I told you I'm a second generation dentist. I don't know who will succeed, but I need somebody in next generation to maintain contact with my patients. This is KaVo. The next generation is already reading digitalized books and articles. Hardware and the software will most certainly progress further. So, for now, we should record and save our patients' total data to enable safer and more secure prognosis in the future. To this end, I recommended the 3D digital data bank. It is restricted to say, but leads to an evaluation and the study of the past treatment. I will now show you the next step I plan to take. Don't listen, okay? I am trying to match the mandibular movement record with a convex CT. This is me. My mandibular movement data, which recorded in Digma 2, are reflected by hand wave. I transfer the reference point into the modified bifold and succeeded in superimposing with a convex CT. The result is shown in this movie. It is already matched with the convex CT. I was able to observe and understand the movement in the molecules part as well. Furthermore, the movement of the temporomandibular joint can also be reproduced. This is not true. This is real. If you have a question about that, is it true? I answer you, yes, we do. This is a very digital solution. So conclusion. Functional analysis can help achieve outcomes similar to those achieved by experienced experts. I recommend the 3D digital data to next generation to ensure safer and more secure prognosis. As a prospective study, these moving images will start a new standard of giving the implant treatment and restoration in near future. I would like to say thank you to Mr. Jack Choi, CEO of the Anatomage Corporation, and Andy and Erin and others, especially when I use my lab stuff to cover this to make this presentation.